Namaste everyone, welcome to today's video. Today we will be discussing a very important topic which is hypertension, or in common people's language it is called as high blood pressure. Its global prevalence or global occurrence is quite high, and you will be surprised to know that half of the patients who have high blood pressure they are still not under very good control in spite of taking medicines. Now, let us first understand what is blood pressure or what is high blood pressure. Now, according to American Heart Association AHA 2017 guidelines, the normal blood pressure is when the upper one, or it's called as systolic, is less than 120 millimeters of mercury, or the lower one or diastolic is less than 80 millimeters of mercury. Then what is the hypertension? Now the same association have said that stage 1 hypertension is when your systolic blood pressure is between 130 to 139 and diastolic blood pressure is between 80 to 89. Whereas stage 2 hypertension is when the blood pressure is more than 140 systolic and more than 90 diastolic blood pressure. Now there is another entity called as white coat hypertension, wherein the blood pressure is recorded high when you are visiting a clinic or a hospital. Sometimes that can be due to the anxiety or anxiousness when patient is visiting a doctor. However, when the blood pressure is recorded at home or out of hospital settings or out of OPD settings, the blood pressure can be normal. So this is called as white coat hypertension, wherein your blood pressure may show high in hospital but it's not actually high. How do we check blood pressure? Now, whenever you are going for a blood pressure checkup, as a patient you should be relaxed for at least 5 minutes before checking the blood pressure. You should not be going there after consuming caffeine or doing an exercise or after smoking, because sometimes that can give incorrect blood pressure measurement. So whenever you are going for first time for blood pressure checkup, it should be checked in both the arms, and it should be an average of 2 readings to see whether you are recording the correct blood pressure. What are the types of blood pressure? There are 2 types of blood pressure. One is called as a primary or essential hypertension, and the second is called as a secondary hypertension. Primary hypertension is somewhere where there is no other reason for blood pressure, but there are various risk factors for primary hypertension. It's usually advancing with age. So as you grow older, the risk for blood pressure development is higher, especially after the age of 50. If you have a family history, then you have twice the risk of developing blood pressure. There's certain races are at higher risk of developing, especially the black race is at higher risk of developing blood pressure, and resistant blood pressure, which is resistant to various medicines, it's commonly seen. The other risk factors are if you are consuming lot of salt or sodium in the diet, that can put you at a higher risk for development of blood pressure, or inactivity, sedentary lifestyle, not much doing exercise, obesity. All these people are at a higher risk for developing blood pressure. Secondary hypertension is where there is some other reason for development of blood pressure. This is usually seen in someone at a younger age, in their 20s or 30s. The various reasons for secondary hypertension or secondary blood pressure are one is a kidney disease, a kidney problem inside. It can be an acute kidney problem, or it can be a chronic kidney problem. It can be due to various endocrine disorders which secretes various hormones which can elevate your blood pressure. It can also be due to various medicines. The list is quite exhaustive. We'll discuss it in a separate video. But commonly the painkillers or NSAIDs, which we call it as, are the group of medicines which can also cause development of blood pressure. Now, why are we worried about blood pressure? Uh, Obviously, because it's complication. It can complicate, it can damage your organs. Now, what are the complications of high blood pressure? It can damage all the vital organs in the body, especially heart, brain, kidney, not to forget retina, the eyes. So these are all vital organs essential for our day-to-day functioning. So control of blood pressure is very important. Otherwise, if you are careless, it is possible that you may damage one or many of these organs which we just discussed. Now, whenever a patient comes to a doctor for the first time, we need to do a complete evaluation for the patient. First, we have to take a history, just see if there is a family history for blood pressure, if he has any bad habits like smoking, not doing exercise, or consuming lot of unnecessary medicines, that puts him at a higher risk for development of blood pressure. In addition to history, we have to do a thorough physical examination, laboratory examination, especially for kidney, heart, to make sure there is no further damage to these organs because of high blood pressure. We have to also do an electrocardiogram or ECG and echocardiogram for assessment of the kidney function. In addition to this, we also do a test called as a renal Doppler in younger people to see if there is any kidney reason or kidney cause for development of blood pressure at a younger age. And sometimes we do a hormonal checkup to make sure there is no other hormonal imbalance in the body which is causing this type of high blood pressure. Coming to the most important part of the hypertension, which is the treatment. Now, why do we have to treat, and what is the goal for the treatment? Now, the goal for blood pressure control is it should be less than 135/85 for someone who is already taking the medicine. So if you are taking medicines and if your blood pressure is less than 135 systolic and 85 diastolic, then it is supposed to be fairly under control. Sometimes in old people it may be difficult to achieve this blood pressure control. So sometimes we may have to individualize the treatment depending on the age, the multiple other comorbidities. Now, what is the treatment advised for blood pressure? Now, treatment for someone who has developed high blood pressure can be divided into two parts. One is a non-pharmacological treatment. Non-pharmacological is without medicine. So now this has to be followed in every case, whether you are taking medicine for blood pressure or not. Number one is your dietary compliance. You have to follow a strict salt restricted or low salt diet so that the blood pressure stays under control. You need to increase your activity at least 150 minutes per week. 150 minutes per week you need to do exercise. You can do it over 4 days, 5 days, but you need to do a regular exercise or a physical activity to make sure your blood pressure to control your blood pressure well. You need to stop smoking if you are having this bad habit. You need to reduce weight if you are obese or if your BMI is high. In addition, we should follow a healthy diet which is supposed to be rich in fruits and vegetables and less of oil and junk food. Now, someone who is not able to control the blood pressure in spite of a change in the lifestyle or changing the habits, we may have to give medicines. Sometimes if a person comes with a very high blood pressure initially, or he already has an established damage to either kidney, heart or eyes, we may have to start him on medicine immediately. Now, the medicines for high blood pressure are divided in various groups as per this chart. Uh, you need to consult your physician before taking the medicine. You should also try to understand what are the side effects of these medicines, because most of these medicines will still have some sort of side effects which may bother you initially. But remember, blood pressure control is more important, and if you develop any side effect due to blood pressure medicine, you should immediately consult your physician and try to change the medicine, or the switch to a medicine which is more suitable for you. Living with hypertension is not all that difficult, especially if you are taking regular medicines. Thank you. The purpose of this channel is to spread authentic medical information to as many people as possible. So if you like the channel, please hit the like button and subscribe. Thank you.